Chronic hepatitis can be a very serious disease. My guest is Dr. Hyder Jamal, a liver specialist and gastroenterologist at St. Jude Medical Center. He'll explain why detection and treatment of hepatitis is so important. Welcome, Dr. Jamal.
Thank you, Larry.
Basically, what does hepatitis mean?
So hepatitis means inflammation of the liver. Liver is one of the largest organs in our body, and it is located on the right portion of our body underneath the rib cage.
And then when we speak of hepatitis, we're talking about some type of inflammation of the liver. What are the causes of that?
So inflammation in the liver may occur from many reasons, and you can roughly divide them into either an infectious kind of reason or a non-infectious kind of reason. For infectious kind of reasons, they are viruses such as hepatitis A, B, and C. For the non-infectious, there can be other things such as medications or fat infiltration into the liver that may lead to inflammation.
How do you know you have hepatitis? Do you turn jaundice yellow all the time? Or what are the signs like, hey, I think I may have hepatitis? What would a patient feel when they want to get tested?
Quite often, hepatitis or inflammation in the liver may not present with any symptoms at all. If, however, it's a severe illness of hepatitis, then they may feel fatigue. There usually is not any pain because of that. Jaundice may occur in case, or yellow eyes or yellow urine may occur in case of a more severe inflammation of the liver. And of course, your physician will pick it up on lab test when the liver test will become abnormal.
So the liver function test in a routine, almost routine type blood test will tell us whether you have inflammation or not.
That is correct.
So why don't we talk about the drugs that do this? What are the common causes of the non-infectious type of hepatitis?
Some of the common drugs include acetaminophen or Tylenol, especially in large quantities. One thing to remember that is even in small quantities, Tylenol combined with alcohol may cause toxicity in the liver. So that's something to remember.
So is a large quantity of Tylenol like 2 extra strength a day, or is it like 6? Can you give a ballpark figure when we should start worrying?
Yeah, so roughly I would say 2 grams, which means more than 4 500 milligram pills of Tylenol is getting into the excessive amount. And if you combine that with alcohol, maybe it does 6 packs of alcohol beer or something else similar to that may result in a problem.
So should I take the vodka out of your cup today?
I should minimize my...
I'm going to make you half a cup of vodka next time. So alcohol, Tylenol, and what about any other common drugs that we use?
Medications that are used to lower people's cholesterol can cause liver test abnormalities. Some joint disease medication or anti-inflammatory medications may cause that too.
Like something like Advil or Aleve, Motrin, that type of stuff?
Absolutely, it's possible.
So probably all those drugs are safe, but you have to be careful with higher quantities, and if you combine them with other, like alcohol and anti-inflammatory drugs, they add up somehow.
All drugs are double sorted. You get the benefit from that, but there can also be side effects. As long as we are vigilant to the side effects and use them with discretion, those are usually safe.
So this looks like a liver of some sort. Is that the normal size of a liver right there?
This is roughly the normal size, but of course the size of the liver may vary from the size of the person. On this side is actually a demonstration of a normal looking liver, which is smooth in appearance.
The dark brown piece
there? The dark brown right here, which is normal in appearance, doesn't have any lesions on it. When people get fat infiltration into the liver size might increase and it may appear more prominent on scans. And there's deposits of fat inside the liver.
I see.
Any chronic liver disease that results in damage of the liver then results in cirrhosis. Cirrhosis appears more nodular and granular and scarred looking. And cirrhosis of the liver can lead to further ramifications to your health, including cancer of the liver that may be picked up on tests and scans.
So before we get to the infectious kinds of hepatitis, tell me about fatty liver, because that's becoming a more and more common diagnosis that I hear, and can you explain it to us, what it means, what causes it?
Absolutely. We should consider that we have an epidemic of obesity in our country. And I think as the problem of obesity has increased in the United States, the diagnosis of fatty liver disease has also increased. In fact, in the future, we think the single biggest reason for cirrhosis is going to be fatty liver disease.
That's amazing, you're kidding.
And increasingly it's a problem because of the fact that our consumption of food is higher, we eat richer foods, there is diabetes in the population, obesity, and high cholesterol levels that are all predetermining factors for fatty liver disease.
So if you get fatty liver, the treatment is weight loss and changing your diet, just to changing your alcohol intake. What other things can you do?
Absolutely, all of them.
All of them.
And so healthy living requires for you to have a weight that's you're not overweight. It requires smaller portions of meal, things that are consumed are not high in cholesterol, improvement in blood sugar or management of diabetes, and if cholesterol levels are high, to manage that cholesterol level.
Now, what about the infectious hepatitis? There's A, B, and C, is that right? And what is the difference between those?
That's right. So hepatitis A, B, and C are named in terms of when they were discovered, A being the first, C being in that sequence being the last. The difference between hepatitis A and B and C is that hepatitis A is only an acute infection, doesn't lead to a chronic disease.
And you get that from food?
You may get that from food. People may either feel sick or get jaundice or turn yellow and then eventually recover and the infection goes away.
Okay.
Unfortunately, hepatitis B and C may lead to chronic disease. Hepatitis B, once acquired, usually doesn't lead to chronic, but in some people does. Hepatitis C, whenever is acquired, almost always leads to chronic infection.
So B comes from blood, is that, and C comes from blood products? What causes that?
Hepatitis B is more contact with people who may have hepatitis B. Not in the United States, but outside of the United States, the single biggest mode of transmission is at birth. However, we also have an immigrant population, and therefore that's one other way hepatitis B comes to the United States is through immigrants.
So you have to touch their blood that has it, or?
And so food preparer, if that person is infected with hepatitis B, that may be transmitted that way. So contact from body secretions is the way to get hepatitis B.
And C comes from?
C almost always occurs through blood contact. So blood transfusion used to be a problem, not anymore, now that we've developed safety mechanisms for that. Now the single biggest reason for getting hepatitis C is either through IV drug use or tattoos.
Tattoos, that's amazing that everybody has a tattoo.
Yeah, it's so mainstream now that everybody has tattoos, and if people are not careful in terms of sharing needles of tattoo or the ink in some cases, then the transmission can occur that way.
So for A and B, there is a vaccine to prevent it?
That is correct. For A, there's just one vaccine. For B, it's a series of 3 vaccines. Unfortunately, there is no vaccine for hepatitis C.
Okay. Should anybody get hepatitis B vaccine, or A? Should we all get it, or?
For healthcare workers, definitely it's mandatory to have hepatitis A and B vaccination. For people who are exposed more in terms of travel, or they have family members with hepatitis B, or they're on dialysis, or they travel outside the country quite frequently, they should be vaccinated.
And hepatitis C, there's no vaccine, but are there medications that can keep it in check?
Yeah, absolutely. And that's a very important question, because the development of medications for hepatitis C has become really successful in the last several years. And now we're seeing rates of success for curing the hepatitis C virus in the range of 80 to 90 to now almost 100% of the patients in the future might be cured from medications for hepatitis C.
Well, that's amazing. The message here that it's not hopeless. If you can get your vaccines, you can prevent A and B. If you get C, hopefully you don't never get it. But
that's right.
Proper precautions, you can prevent it, and the medications can potentially in the near future give us a good long-term outlook.
Absolutely. And medications have been difficult in the past, but they've become increasingly easier to use, manageable side effects, and now we're seeing very successful rates of cure.
Well, I'm going to go make sure my vaccines are up to date. It was a great topic. I appreciate it very much. Thank you for coming. I think we learned a lot today.
Thank you, Larry. It's a pleasure.